Hello and welcome to Pain Unfiltered, where we go in-depth into the interventional pain and spine world with some of the top key opinion leaders and executives in the space. We are your hosts, Dr. Patrick Buchanan and Dr. Timothy Deere for this Aspen podcast. Let's get started. Hello and welcome to episode 9, season 3 of the Pain Unfiltered podcast. I'm your host, Dr. Patrick Buchanan, and with me is my co-host, Dr. Timothy Deere. Tim, there's been a lot of focus on AI and health recently. I feel like I'm being constantly hounded about peptides from friends and family and all these AI tech stocks and everything. It's about open AI and all these investments. But that's a different conversation. And I know Aspen has announced a new committee focusing on health, longevity, and age-related pain, as well as an AI division led by Dr. Robert Mogum. Can you talk about the impact of health and AI when treating our chronic pain patients, and the role of Aspen has decided to take on in supporting this?
Well, Patrick, thank you. I'm so excited about this podcast today, having both Dustin and Rob here, because really it meets a lot of our goals. And in the last few months, we've created not committees, but divisions, which I want to make sure people understand what that means. It's a total commitment to AI, chaired by Bobby Mogum, as you said, but also with Usman Latif and John Prunxis and others who's doing a great job. And then we have our division really dedicated to health, wellness, and longevity. And that's going to be, I think, a more important part as we go forward. We have so many unhealthy pain patients who really have poor nutrition, really don't take care of themselves, have poor health habits. And certainly everything we can do there is important. And now I'm announcing on this podcast, and more details will come, we're going to have a division of education, which will cover everything from medical school education to the 65-year-old person getting a new technique education to patient education. So if you combine the three things, AI, health and wellness, and education, that's really why we're having this podcast today, Patrick, to talk about really the combination of those three things for patients, not just in the pain community, but throughout the medical community. So I'm so happy about today's podcast. I'm excited about our discussion, and I'll let you introduce the topic.
Well, I appreciate it, Tim. Obviously, this can't be done without your leadership with Dawood as well. But that transitions right into our guest today, and obviously, and also announcing our newest sponsor to the podcast, Lembas Health. So we appreciate you guys coming on. I would like to introduce Dr. Dustin Reynolds, Chief Physician Officer, and Robert Miller, co-founder of Lembas Health, to discuss nutrition and AI in our medical field and what makes their product unique. So thank you guys for joining us.
Absolutely.
Thanks for having us, Dr. Buchanan. Dr. Deere, appreciate you bringing us.
So we'll start with you, Rob. Just give a little bit about your background and how you kind of found this niche, and then we'll toss it over to you, Dustin, to quickly introduce yourself as well.
Yeah, Dr. Buchanan, thank you. I appreciate it. And Dr. Deere, hopefully this will be kind of a continuation of some of the fun conversations we've had around nutrition and how to find the feasibility of it in healthcare and in different specialties along the way. But as fitting, I think, for the majority of my life, I get to be the black sheep on this podcast today, the only non-MD in the room. But I come from a long history of docs in the family, back to my great grandfather. My grandfather was an orthopedic surgeon and a rear admiral in the Navy for a long time, and both my parents are private practice physician docs. Both siblings went to medical school. It's actually the path I went on with them to meet Dustin, funny enough. And when they all did that, I decided to go in a completely different direction, start working in tech startups and entertainment, but spent a long career in tech startups, mainly food and agriculture, to really getting into the nitty gritty of what's happening with our modern food systems, actually on that side of things, and the role, major food companies, major agricultural companies play in how we eat on a day-to-day basis. And then lo and behold, I married my better half. She's a registered dietitian by training and got her doctorate in nutrition at the University of Pittsburgh. Now is actually on the food side of things, but the whole world of food as medicine and nutrition has really kind of been a huge part of our lives for the last, better part of the last 15 years. And, I've made my way now into the clinical world and really, kind of hyper focused on taking this opportunity. And as you said, it's kind of timely with the announcement of your AI division here, but really trying to make sure we harness the power of artificial intelligence and make it as a tool that can enable the future of what being a provider looks like. So I'm sure we'll get into it a little bit more, but Dustin, I'll pass it over to you.
Sounds great. I'm just a farm boy from Northwest Ohio that somehow found his way to Columbus here now. Anesthesiologist as my primary specialty, interventional pain physician now, working for an orthopedic and neurosurgical practice, but similar upbringings to Rob without the medical component. No one in my family, except for my sister, I guess, has involved anything in medicine. But as a physician now, as a past athlete, someone that does care about nutrition, I've always wanted to find a way that we could properly discuss nutrition with our patients. I feel like it's been a missing component for years. We know that obesity and other chronic care conditions are not only an epidemic, but a pandemic. But we just want to be able to give back to those patients in the right way, the medically correct way, evidence-based fashion. So it's exciting now what they're doing. We need to empower the physician. I think we have found a route to do that now. As we all know here, through medical education, we are not properly taught nutrition at all. I mean, I think the average is 3 hours of nutritional didactics throughout medical school across the country. That needs to change. The curriculum needs to change. But we need to feel more competent having these conversations with our patient. And that's what I loved about Lembas, what Rob has created, joining the team now, just making those conversations flow and giving them that companion piece.
Yeah, I want to ask a question, to Dustin, and then I want Rob to finish the answer. So, and then Patrick will take back over again. But Dustin, here's my question. I had Rob visit me recently. I know he's up there in Hoboken where people are healthy and skinny, walking every day around the lake, around the river there on the Hudson. But, most of your patients are really worried about their back, right? Their spine, their nerve, their whatever it may be that brought them to see you. And many of them are overweight. They haven't seen a piece of bologna they haven't liked in a long, long time, right? Processed foods and, all those things. I guess my first question from you is going to be, do you think introducing an AI-generated nutrition advisory to our practices is going to be accepted by our patients? We've always focused on ding dongs and Cheetos many times. Not all patients, but that's very common, right? Poor diets, lack of activity. You think they're going to accept this? And then when you explain to me why they will, and I know you also do orthopedics in your practice, another big group of people, family practice, refer to both of us. And then I want Rob to then tell me briefly, and then Patrick can follow up on the more technical questions, what that looks like as his coming helps us do that. So can you start with how is this going to be accepted by pain and orthopedic patients? What's the message we can give? And what's the uptake going to be in your opinion? And then have Rob talk about the execution of that uptake.
Absolutely. So the focus in this are two parts. One, the physician. The physician needs to be the mouthpiece. That driving home our message. The message being, we want to be an unassuming healthcare company, a product, a companion piece, empowering the physician, not telling the patient, hey, you need to go out there, you need to eat broccoli, chicken, white rice, and completely disrupt their way of life right now. We want to work with them. We want to make small changes and roll that out over time, make it sustainable. I mean, there's, a lot of cognitive and behavioral aspects to this that aren't going to change overnight. We're not trying to do that. We're trying to give them a piece that can come right to their phone or even a printed out version that's saying, hey, you're going to McDonald's 10 times a week right now. Maybe we start there. Maybe we change your order first. You're still going 10 times. Maybe we change that, and then maybe you start going less. Maybe you go 9 times, 8 times, until you've created this dynamic, well-rounded plan that's going to focus on you and your pathway, not someone else's pathway, not another patient, not what social media and Instagram is trying to show you what to eat, what to look like, all these things. Our focus is going to be on you, the patient, and you, the physician, providing that information in a way that can be trusted.
So Rob, how do you do that as a company? How do you take that thought Dustin had and then engage the practice with that?
Absolutely. Dr. Deere, it's pretty interesting. A couple of weeks ago, I was shadowing you in the clinic, and I think it was the first patient we went in and saw for the day. We walk in, kind of get through some of the pleasantries, and then maybe within, I don't know, the first 90 seconds, you were beginning to kind of talk about potential in the procedures that this patient could undergo. Patient looked at you and he said, "Doc, to be frank, if you told me that I needed to cut my foot off right now, that's what I would have done." Right. And that was a pretty interesting moment to sit there and follow you through that patient experience, not only how you reacted to that type of, piece of feedback from the patient, but to go into the psychology a little bit of where that patient is. And I think that harps back to the way you asked that question, which is they're coming in worried about their back pain. What's going to get them to stop eating the McDonald's 10 times a week, right? And the answer is you're not going to capture them that way. But I think that's where we get the most excited about the potential for what nutrition and the involvement of nutrition can be in medical practices, fusing it with artificial intelligence capabilities. We're kind of at this very pretty massive point in time for what medicine can become and how healthcare is going to evolve because of technology's influence. Ultimately, we don't really need, the physician in the room or even the NP or the PA that might be interacting with that patient to grab that patient in that moment that they're saying, "Hey, I'm in so much pain. My foot could be amputated right now and I'd be okay with it." You're not going to capture their attention with nutrition at that point. But what our goal is not to go in this direction we've been in for the last 3 decades, which is trying to combat somebody eating at McDonald's 10 times a week with more Jen and Craig, with more Weight Watchers, with more of these programmatic approaches where we're putting more and more emphasis and time stress on these patients. Now they're leaving the clinic with you. They're thinking about this upcoming procedure and they've got to go do this whole program. That's not how we want to look at it. We really want this system to embed itself really at the most infrastructural layer of care with patients so that it's something that is just automatically happening during the engagement. It's almost an expectation for when I go and I receive care from my, interventional pain management doc, that if we're talking about something that is ultimately happening, maybe because of a history of obesity or the type 2 diabetes, hypertension, probably all three, that there is this expectation that I'm going to get guidance in my lifestyle that is going to coincide with everything that's happening from a surgical standpoint. And that's where I think we almost look at things on an epidemiological level rather than, of course, we have to zoom in and go case by case, think about the patient experience. How do you make this a really incredible, user experience, something people adhere to and engage with? But almost at an epidemiological level, I think back to how my parents' practices, dad was a pediatrician, mom was an OBGYN. And over the course of, a 40-year career, to see how diet-related disease changed their practice and the complexity of patient that they were seeing, yet they had no scalable way to deploy nutrition to even coincide with the care. Over a 40-year period of time, if you had something that could sit alongside a patient, even just offering hyper-personalized advice on how they should change their order at McDonald's and then eventually eat healthier and healthier over time, we could impact 10% of those patients. We'd be changing millions and millions of lives. And so we really think about using artificial intelligence, these AI systems, combining it with evidence-based nutrition to get into the nitty-gritty of how somebody thinks, how they might interact or how they might even, react to being approached with a nutrition protocol. We meet them where they are, and then we make it the standard of care. If we can change the lives of 10% of the people in the United States, 10% of people in the pain management community, we're changing the lives of hundreds of thousands at that point.
Absolutely.
Yeah.
Just adding on that, with Rob, making this about pain, being in the space, I mean, we know that the patient's not coming to us for lifestyle management. This is just an extra core component we can add, really educate them on inflammation and how that adds to their pain. We got to get down to that foundational level with nutrition that's going to help them, on their NRS scores, everything else that we measure metrically throughout the field. But it's got to start at a more basic level, not just coming into us doing PT medications, bread and butter injections, moving on through minimally invasive procedures. But we need to incorporate nutrition. This is a way just empowering that physician to be able to do so now in a new model and approach.
Yeah, I totally agree with you, Rob, in terms of having nutrition as part of our chronic pain treatment program. And as you said, it's case by case. I'm going to turn this over to you, Dustin. Anecdotally, I'm sure you have as well, but we've seen patients who have changed their diet to an anti-inflammatory diet and say, oh, I have less fibromyalgia flare-ups, so my knees feel better. So can you tell us, how personalized treatments go? What is the difference between a patient's nutrition program with someone with diabetes and neuropathic pain versus someone with osteoarthritis?
Yeah, absolutely. Well, focusing on the osteoarthritis first, I mean, I deal mainly with spine and joints, being with this orthopedic and neurosurgical practice. Want to look at the inflammation, those anti-inflammatory diets for sure, working with our registered dietitians to deliver the most up-to-date care plan that can effectively deliver specific nutrient profiles that may be different on a patient-by-patient basis. So inflammation there, but then looking at obesity within that osteoarthritic population, really getting the patient to focus on force reduction, taking, 1 pound of loss in their life equaling 6 pounds of force, or 6 newtons of force being reduced from the spine, 4 newtons of force being reduced off, the joints. I mean, that's impactful. That's something that patients can actually wrap their head around. So breaking it down to a very, very simple construct for patients to understand, I think that's the most important thing. And then switching gears and talking about diabetic management, we work with a couple different metabolic clinics that focus on peripheral diabetic neuropathy or optimizing patients for surgical procedures and doing insulin infusions and things like that. I mean, yes, they're losing weight, but we're seeing drastic reductions in their hemoglobin A1C. I mean, that's just through changing their nutrient profile, working with that registered dietitian that is developing the care plan just quicker using AI. It's not like they're really interacting with the AI themselves as a patient, but it's more the care plan that's just generated so much faster than what registered dietitians were able to do before. We want to empower the physician, empower the registered dietitian, but just make it more efficient and streamlined so the patient's not guessing, when they're going out to the grocery store, cooking at home, ordering from their, favorite places, Uber Eats, whatever it is, as long as they have that education piece that they trust, knowing there's a team behind them, I think those are the core things to focus on. And then you can start breaking it down more and more and educating them on a more specific level about what's truly going into their body.
Dustin, I think that's a great, I love everything you said. I think it's so true. But now I want to get down to what the program can do in a practice like ours, like Patrick's, like mine, like yours. Rob, you're not the MD here, but I do think you're going to have the answer here. Okay. Because, we're not knowledgeable about AI. In fact, I was on the phone with an AI bot when Rob visited me. He said, that was Rob. I thought I was talking to a woman named Sally. I'm like, what? So I was a little pulled there, but anyway, that's another story. So Rob, here, here's my question. So I see that patient we talked about. We do a spinal cord stimulator in that patient, and he gets great results. And he comes back 3 months later after the device. His pain is well controlled now, but during his time of convalescence, when he had the back surgery and all these other issues, he gained 80 pounds. He ate poorly. He became a really metabolic mess. He's got this truncal obesity now. And he says to my nurse practitioner, because they do most of our follow-ups, Danielle, I really can't, function still. My pain's better. I can't function. I got to get healthier. So how, if we decide to opt into your program, how would that PA or nurse practitioner then say, oh, guess what? We have something to offer you. How is that initiated to a patient? Like, how's it work in the HR system? How's it work for, RVU or billing processes? How's that work in a practice? How do we bring that in so that we can, utilize time to do it and make a difference in that patient?
Yeah, Dr. Deere, it's a great set of questions, and I'll probably chunk it out just a little bit into kind of how the service or how that care would be initiated with the patient, and then maybe how that billing and that reimbursement portion really plays out for a practice and on the RVU side of things, that sort of split here. So generally speaking, from the very beginning, when we developed this system, one of the most critical aspects when we said, hey, we're going to do this through the lens of the physician, we're going to do this through the lens of the APP, is we cannot add more burden to the workflow that already exists. And I think that's one of the areas, especially as an early stage startup, we hear this constantly, whether we're talking to bigger health systems, whether we're talking to private practices. Hey, I don't have time. I'm already pressed with all of these, patient interactions that I have. We're having, conversations about what's going to happen procedurally, maybe even this patient who comes back after a procedure and is struggling with their functionality. Everybody is still really pressed for time. So this has to be something that really slots into that workflow. So really at the end of the day, where it starts is a conversation about what's happening with a person's lifestyle. I think the way we've thought from the very beginning about nutrition's involvement in somewhere like pain management or the orthopedic setting is similar to that conversation you might have around exercise, weightlifting, strength training, physical therapy. There's this growing body of evidence to suggest that really diet has a larger impact on long-term chronic pain, that any of those areas could show improvement for somebody, how they're feeling. And so it really just starts with a simple conversation about what's your nutrition lifestyle like? How are you eating? Getting a gauge for what's going on with that patient. And then really it's talking about the fact that you can address their nutrition care, Lembas being embedded in somebody's practice without needing to leave the grounds of that practice. We don't need to refer you out somewhere. We don't need to send you to another place to go through, multiple interactions and multiple sessions with a registered dietitian. Maybe your insurance covers it, maybe it doesn't. And we talk a lot about keeping care, that continuum of care inside of the practice. So technically speaking, we integrate in a custom fashion almost with any physician's workflow. So whether that look like an EHR integration or really ultimately a more lightweight workflow that works outside the bounds of EHRs, as I know a number of practices who typically in the private setting aren't really working with the likes of Epic, but might be working with one of the other EHR systems. Everybody kind of has their own feeling around what integration feels like. So from the beginning, we try to integrate with practices workflow in the way that is simplest for them. Really, it just starts with a conversation with that patient from, the NP to PA in that setting. We'd love to address your nutrition. We have a really, really simple way to embed hyper-personalized care into what's happening, with your health management here, in a way for us to start to reduce that load on your joints, to start to reduce the inflammation, and you don't have to drastically change your lifestyle. We sit inside of the EMR, and when that patient's information is shared with us, we're able to scrape all of their medical history, their dietary history, and all of their chronic conditions, and ultimately ingest that into our system in a very, very data and HIPAA compliant way. But we ingest that into our system, and that's really where the process begins. We learn the behaviors that the patient likes to be communicated in, whether that be through an email setting, digital setting on their phone, and we interact with them in those ways. And then ultimately, aside from the hyper-personalized nutrition care that's being given to patients on a month-over-month basis, where we really tried to tackle the reimbursement side of this is giving practices a new way to bill for chronic care management. Now, I'm sure a bunch of folks who might listen to this episode are already familiar maybe with the RPM, RTM side of things, maybe familiar with CCM, chronic care management. But if you're not, essentially, this is a coding set that was introduced by CMS, I believe back in 2015, 2016. with the idea that they wanted to give a fee-for-service modality, if you will, to bring more of a value-based care service into these clinics. So a way that you can actually get reimbursed for all of this care that you're doing for chronic care management outside of, the walls of your clinic. You're calling patients, helping make sure they're adhering to their medications, kind of avoiding the emergency room. We looked at what was going on in the chronic care management space and a lot of the billing practices, and we were actually really unenthusiastic about a lot of the companies that were coming into the space. It felt like a lot of smoke and mirrors. Hey, enroll this person into this chronic care management, monthly recurring, setup. You can get paid, $60 by CMS per patient per month. And what we were seeing was all these patients who were, either, filing against practices or saying, hey, I didn't even know I was enrolled in a program. And we said, wow, what an incredible code set that is being manipulated, completely, incorrectly for these patients. And with the support of these AI systems, we said we could really do some good introducing a real chronic care management program into these practices. So that's exactly what we did from a billing side of things. This nutrition system is integrated into the practices and the clinics we work with through the existing CPT codes in CCM. And that is now being picked up by not only Medicare bills this reimburses this code, but this is being picked up virtually by almost every commercial payer across the country because of the results they're seeing from a patient improvement standpoint. So we come in, we embed ourselves inside of the EHR, really limiting any work that the provider needs to do with that patient, other than encouraging them or getting them excited about a lifestyle intervention through nutrition. And then we manage all of that chronic care management on behalf of the practice with the registered dietitians and care coordinators and our team, then giving the clinic the ability to reimburse and bill for those codes. We stay on top of what's happening with that patient in a month-over-month basis. We make sure that they're progressing with their nutrition. We make sure they're tracking against, maybe it's A1C reduction, maybe it's weight management, but we're responsible for that, making sure all of that data is sitting inside of the EHR at the end of the day. So we can track results and give practices a way to actually get reimbursed for nutrition care, which really has been almost virtually non-existent up until this point.
No, I want to focus on those 2 points real quick that Rob hit on. Number one, it's something real and it's something good. I think this is the most altruistic thing that we can do for our patients in our practice, not just as pain providers, but coming back and giving them a true care plan with nutritional care. I love that aspect of it personally. But number two, the other aspects, those admin companies that already kind of exist in this space that I get an email about probably 3 times a day, that's exactly what they are. Just pure admin companies. Yes, you could probably build the codes and go through that and make money, but what are you actually doing for the patient? What are they being provided? Nothing. I haven't found one yet that I've truly trusted or wanted to even incorporate into that. I'm not just, biased with Lembas, but I've been looking something for nutrition specifically, and I don't believe that any other product out there on the market right now does exist in a way that truly is putting the patient first.
Yeah, well, I think you guys perked the ears of a lot of physicians that are going to be listening to this podcast. It's going to help our patients overall with their treatment program, and it's billable by using the CCM code. CCM code. I'll turn this over to you, Dustin, really quick. How has this impacted your practice personally with your patients using this?
Yeah, so my patients now, we've gone through this transition, kind of bought out by private equity and having some red tape. So it took a while to get off the ground there. But the feedback, the data that we've been collecting, the metrics we've been using, patients are doing very, very well, especially here in Central Ohio, not just within my practice, but we have at least 5 other practices that are onboarded here in Columbus now. We're in 5 different states. We're getting the same feedback. We are following those patient journeys very closely. We're seeing those hemoglobin A1C reductions. We're seeing significant weight reductions. Patients enjoy their interactions with the platform more than ones that have already worked with registered dietitians in the past. I mean, that was one of the most surprising things. You would think working with a registered dietitian outside the practice would provide more one-on-one care, but most patients feel that it's just more burdensome, time consuming because they're having to go to these other offices. They're having to spend this extra time. Now, this information, like I said, can come straight to a patient from us, be a PDF version, if they just want to have black and white in front of them, and that can change month over month, or they can actually have it come to their smartphone, and they can read and interact with it that way. I mean, we have multiple versions that are set up for success, but patients are saying that they like that more, less time consuming for them, but getting them the information that's needed.
I think that's, Dustin, just on that note really quickly, one of the things we tried to tackle really early on with this build, and this probably comes a bit out of the other kind of tech startups I've been a part of in the past, is thinking through user experience really early. When we think about the concept of like adherence in general, I think that's something that plays almost the entirety of the healthcare setting. How do you actually get patients to adhere to what you want them to? And the ultimate goals here being weight reduction, A1C reduction, kind of those heavy hitters, those heavy indicators. There's a lot of other ones that we could dive into, but a lot of this really, really starts with patient satisfaction, actually. And so building something for them that they love, that they will come back to, and you can use the same metrics you might in any other consumer app. If somebody loves using Duolingo to learn languages, and I only shout out Duolingo because I'm a Pittsburgh guy at heart, and they're one of our good success stories up there. So, but if you think about, hey, Duolingo was great. I love using this product. I'm learning so much. I'm going to go back more and more. And then my metrics start to increase and my language learning capacity. And before you know it, I've learned this new language. We try to bring the same perspective to whether that be gamification of what somebody's experiencing with these nutrition protocols, these care plans, getting into those nitty gritty details. We bring a massive data set of evidence-based and cognitive behavioral theory to the AI models that we're creating, not to mention the registered dietitians that are on our team. That's all baked into the model that we created in the outputs. We trust the science, and it's all data-driven over decades of results. What our goal now is to create is, we know the science makes sense. We need to deliver it to every single patient, almost in a unique way to them. So it's almost like every patient is getting their own unique program developed for them, knowing that we can reach these outcomes if we can make them happy and get smiling faces at the end of the day.
Yeah. So let me follow up on that. I have a question, kind of, it'll be a brief question. I know we're kind of going along on time a little bit, but I want to ask Dustin a question, and then I'm gonna follow up with a question to Rob. So Dustin, I'm a Garmin guy. Garmin's out of Kansas City, Missouri, I think. And I look at my data on every run I do, and what was my cadence, what was my heart rate. I think there'll be patients like that. I think we met one of those patients who's kind of a socialite here in West Virginia when Rob visited me, who really cared about, how was her yoga performance that day. She was really into Pilates and all these things, and really it was data driven. And I know we have patients like that. Have you found that patients really that engage in this really like buy into really understanding what's going on with their overall health? Is that something you see as a benefit?
Absolutely. 100%. I think having those black and white numbers in front of patients and all that we do drives home our points for success down the line. I mean, I always use my own anecdotal data for neuromodulation in my practice. Whenever I do trials and go to implants and whatnot, and I say over the last 500 patients, that I've had since been here in practice, we had XYZ results. I mean, that helps them wrap their mind around that, and letting them know that there's hope, that there's positivity, optimism for change within their life. It's the same when it comes to nutrition, giving them that data from these other practices, not only here in Central Ohio, but across the different states and regions that we work with. You're like, hey, there's patients just like you in this country. You can be one of those. We can change your diabetes. We can change, your obesity, your hypertension, just by looking at food slightly different. Not being this unassuming product that's trying to make you into someone else in this model that's unachievable. But no, we're focusing on you and how that works.
Rob, I'll give Patrick the last question. I want to ask one more question and then we'll conclude with Patrick's question. My question for you, Rob, is, I wrote a paper with Peter Statz and a group of experts on remote monitoring. And we have a podcast coming up on remote monitoring with spinal cord stimulation. And we found in those patients who have devices in their body, passive monitoring was a whole lot easier than active monitoring, where the patient had an input. This sounds like to me this requires some patient input. And Justin just said patients like that data. So my question for you, Rob, is it a challenge to have patients input their own data, or are they more of an observer of their data? What's the patient journey here? And then we'll have Patrick ask the last questions.
It's a great question. Before I answer that, I do have to say, and for those that might see this video, I am a Koros guy at the end of the day, an aspiring endurance athlete. And I know
This is a Garmin, but normally I have a Garmin on. Koros is terrible, but go ahead.
No, it is a really good question and something we think about pretty extensively with the rest of the team here at Lembas and as we develop this technology. And I think the best way that I can answer that question is to actually almost kind of provide a real insider's look into like the state of where we are as a startup and where we are at this point in time. We fundamentally believe as a team, and this kind of maybe goes back to some of the tech principles I developed when I was in grad school at Carnegie Mellon, really kind of a nerdy place to be, but an exciting place to be when it comes to technology innovation. We always have to think about skating to where the puck is going to be. And I think maybe this is the affinity I have for the medical community, physicians, what I see from my family and growing up around them. I fundamentally believe our job as a startup and innovating in technology is to eventually skate to where the puck is going to be in healthcare, where it's going to be in weight management, where it's going to be with the impact that things like GLP-1s are going to have on this entire sector, every specialty across the board, once affordability, and we're already seeing that at the governmental level, becomes more, accessible. And I think to answer your question about that passive versus active monitoring, the answer is you're absolutely right. In the early days of developing this system, we have, really strong enrollment rates with the patients we're currently working with across all the practices we're with. At the same time, we know that active monitoring that we currently undergo with those patients is ultimately going to have a stranglehold on the incredible work we could do over time. And we know that we're only at the beginning of that process right now. So, Dr. Deere, when we were together, we talked a lot about feasibility studies. And I think we're really at this early stage of feasibility for what nutrition's role can be inside of specialty care, in this case, pain management. And so when I think about us having the role of being an active monitor right now, what we're learning is for those patients that really can engage, why are they engaging with us? And then we are getting feedback on areas that we can improve. And we're certainly learning at what extent or what, point in the timeline we start to see a diminishing, patient engagement, or where we were getting better data at month 3 versus month 6. And the ultimate goal was to create an agentic system. And I apologize for throwing the AI buzzwords around, but this almost agentic, this automatic living system that fundamentally understands all of your personal behaviors. We are going to be integrated across all wearables that people have access to. You're seeing EHR integrations on that across the board. We'll be able to pick up on your behaviors to know that, and Dustin, sorry for throwing you under the bus here, but you're going in for that frozen Snickers bar at 9:30 p.m. on a Tuesday night. We'll be able to jump ahead of that with a digital nudge saying, hey, it's 9:25. We know what time it is for you. We know that maybe you could make this adjustment because you prepared for it based on the nutrition care plan that's already been developed for you. And you had a healthier option sitting in the fridge than that Snickers bar that's in your freezer. And I think that's how we start to think about becoming passive, is the role that AI is going to play as a companion in people's lives, because it's so, this might be scary, but we're going to do it in a safe and secure way. But the extent to with which it will understand patients' personal behaviors, understanding their history, their familial status, their work stressors, why they do the things they do, how they tick, that's where we'll become passive. It's going to start acting, and we're going to work through the feasibility of that as we progress. But in a matter of, a month, 12 months to 2 years, this is going to, in the progression we're seeing in our AI system, this is going to flip to becoming passive, and we'll know how to engage those patients on a one-on-one basis.
I want to touch on that too. And Rob had already mentioned, but partnerships. I love Aspen. I mean, I think it's one of the best societies out there. I mean, the community, the engagement, the mentorship, what you guys have created over there, it's something special. So as a startup, as a young company here, and being involved with Aspen now, we want to develop more champions and partners across the country where we can develop strategic care plans together as physicians, have a true community where we can talk and be like, what metrics are, smart for our patients here, but look at passive and active engagements, looking at other, industries and companies, the Abbotts, the Medtronics, other systems that we could use together to create this ecosystem that just helps the patients. So that all around integration, I think, will be great. But coming back to our community that's already so special and just making it even stronger through this approach, I think could have some real legs.
Well, that's great. Rob, that sounds both exciting and scary at the same time, with AI already anticipating our next moves. But it's probably already on the way, and there's nothing we can do to stop it. But my last question, pretty much you guys answered already, is where you see this nutrition and pain and AI and pain management in the next 5 to 10 years, and you pretty much described it. So I just want to thank you guys again for coming on. We'll have our closing thoughts. Tim will have you lead, and then Rob and Dustin, you can send us off.
No, I mean, I never really thought much about us changing the journey of a patient's nutrition and health. I thought about us making their pain better and their family doctor dealing with these issues in the past. And so my eyes have been opened a lot here with Rob and Dustin educating me about how integration with AI into our medical records can really potentially change the journey of the patient. And I think it would improve our outcomes, losing a pound, taking weight off your spine, weight off your hips, your knees. I mean, so really, I think the last month and a half, if we engage in these conversations, and now today in this great conversation, which I'm sure thousands of people will view, through the podcast or listen to at least. I think to me, it's a new era for pain physicians, orthopedic surgeons, others, that we don't have to give all those things over to the primary care physician. They have a lot to do already. We can also integrate some of that healthiness into our own practices. So I think this will change very quickly. When I go to those CME meetings, Patrick, and they say, will this change your practice? You always say yes, but you really don't know how. This actually will change my practice, I think. And that's rare that we find somebody that really changes the practice. So to me, this is a new era. I think if the integration goes well, it's going to change a lot of people's lives for the better.
Dr. Deere, on that note, it stuck with me from that conversation we had around feasibility. And it's something that's probably kept me up. You don't know this, but probably kept me up till about 3 a.m. every night since we talked 2 weeks ago about feasibility. And I think, to be honest, that's exactly where we're at. We fundamentally believe in the science. We believe in the data on evidence-based nutrition. Our job is to make this a feasible approach for, physicians and providers in the pain space. And that means it needs to be, operating with all of you with trust. And most likely, once you trust it, it needs to hum and it needs to work. And that's exactly, what we're cracking against. And we're in the early days, but it's been phenomenal getting to know both, yourself, Dr. Deere, and yourself, Dr. Buchanan. And honestly, all I can say is I appreciate, for an early stage company trying to, implement nutrition, I think for a healthcare industry that is fundamentally changing and going to look a lot different because of diet-related disease over the next 5 to 10 years. Both of you, opening up your ears to what we're working on, and Dr. Deere, you having us down in West Virginia and opening up your clinic literally to us to see your patients, even pitch a few patients on what nutrition could mean, is completely invaluable to this portion of the journey. So a heartfelt thank you for helping us, in the early days and having us be a part of this conversation.
Thank you.
I just want to drive home a few parts and points that Rob just hit on there, the feasibility, streamlining this approach, making it easy on our friends, our colleagues, our other physicians out there, just having a companion piece that allows you to have these difficult conversations about nutrition that one, you may feel incompetent doing so because of the lack of education that we were provided during medical school and training, but feeling, safe and secure and competent, delivering that now, knowing that you have a true team of registered dietitians and individuals like Rob and the others behind the scene that are just there to help. I think that's one. But two, coming back to the point that this is doing something real and something good. We all know as physicians out there that nutrition needs to change in America. This is how we do that. This is something that can be baked into every patient's journey. We could find a way to make that work. We know it's going to look different for everyone, whether that is coming to their phone or it's a printed out version. Whatever we can do as a physician to be that mouthpiece, drive home those points that we're there with you and we're going to help you and assist you through the rest, of these changes that you need to make, and that's going to be great. But it's something real and it's something good. And I'm just excited to work with anyone, any physician that feels like, hey, this might be right in their practice. You have questions, I'm available anytime. That's my love of working with Lembas now, working with the physicians, helping them, being that mouthpiece and helping their clinic.
Well, thank you, Dustin and Rob, for both joining us. I think this was a fantastic conversation about health and nutrition and AI. Again, like we talked about at the beginning, we're not trained as physicians on nutrition in our training. And this is another tool in our toolbox, and excited to use this with our patients. Tim, again, thanks with your leadership for opening up the divisions for AI and health and now education. I'm excited to see where that's going for the next years to come in Aspen. Dustin, you're one of the rising stars in Aspen. Looking forward to seeing what you're doing with not only this, but publications, podium speakerships, and everything else. So thank you for sharing your journey. And Rob, looking forward to using your product and helping my patients as well. So thank you guys for joining us. And this wraps up another episode of the Pain Unfiltered podcast. Thank you all for joining us.